Welcome back. San Antonio will soon be home to a new National Tuberculosis Research Center. It's a new designation for Texas Biomedical Research Institute on the west side.
If you're wondering why that's important or even have questions about what tuberculosis is that still a disease that affects a lot of people? We're going to talk about all of that in today's KSAT Q&A. We are joined by Dr. Joanne Turner, the Executive Vice President of Research at Texas Biomed. Dr. Turner, thank you so much for spending some time here with us this evening. Let's first talk about what this designation means for Texas Biomed. How will it affect the work you all do?
Well, it really brings a new project to our campus and also something new to San Antonio, where we will be training the next generation of scientists that will study tuberculosis and do that in a way that gives them a very interdisciplinary training so they can really tackle the really, really important problems we have that slow down our ability to cure or treat this disease.
So let's kind of take it a step back here, and just for people who are, joining us or they have questions about TB, what exactly is tuberculosis?
It's a disease caused by a bacteria, and that bacteria typically enters the lung and makes a residence there in our lung. And for some people, there are no symptoms of disease, and in others, that bacteria continues to grow. It can cause significant lung disease, lots of coughing, a lot of weight loss. And if left untreated, it can actually lead to death.
Of course, we've spent the last 2 years talking about COVID and how that has been the primary focus when it comes to health and contagious diseases across this country and the world. But is tuberculosis still something that is really impacting people? I mean, is this fatal for a lot of people?
It's a significant problem for a lot of people. We have about 10 million new infections every year globally. We have 1 million deaths from tuberculosis every year. And we have TB in the US. So we have more than 10 million individuals who are infected, not necessarily sick, but infected with this bacteria. So it's an ongoing problem. It's definitely here in Texas in some areas, particularly around the border. And it's something that we continue to struggle to treat effectively.
And how do you compare TB to COVID, obviously, because COVID is a virus that we're a lot more familiar with. So I just feel like that's a good reference point for people to understand. How is TB different? Is it deadlier? Is it more dangerous? What are the symptoms?
It's definitely been around for longer. So it is a pandemic, just like we think of COVID as being a pandemic. It's a pathogen that likes to live in the lung and cause lung disease. And can cause a lot of significant death. What you see the difference in is often the timing. The virus that causes COVID-19 is very acute, gets into the lung and makes you sick very quickly. The bacteria that causes TB tends to be much more slow growing. And it really will become a problem over time in an individual. But essentially, they're the same public health concerns, transmitted primarily through breathing and causing significant lung disease.
Where does this bacteria come from? I mean, is it something that it spreads from person to person? You have to be in certain environments to pick this up?
It does spread mostly from person to person and through particles that we might breathe out or cough or sneeze. That's really the best way for transmission for this bacteria. It can also live in the environment for some time.
So we discussed how us having a designation here as a National TB Research Center with Texas Biomed. Is there any benefit to the people here?
I think there would be. So we're essentially training scientists on our campus and scientists down in the clinics near the US-Mexico border and here in San Antonio in our own TB hospital in San Antonio. And so it does bring new individuals to work at our institute. So there's some employment opportunities, some training opportunities. And it also really highlights some of the strengths of San Antonio. We're a really strong biomedical culture in San Antonio, and this adds to that and really creates this wonderful education initiative that we can talk about citywide.
We've reported on the fact that Texas Biomed, when the pandemic began, you all shifted everything to really focus on COVID-19, understanding the disease itself, and then, of course, moving on to later understanding how the vaccine would affect animals and then later on humans. So talk about how COVID had an impact on tuberculosis, because since there was such a heavy focus over the last 2 years on COVID, we know that other illnesses just haven't been getting the attention that they used to.
Exactly. And for Texas Biomed, we had so many researchers studying tuberculosis that have the skills needed to study SARS-CoV-2. That was a plus for us. We could quickly pivot and work with this virus. But nationally and internationally, COVID has distracted from TB treatment. So individuals may not get the hospital care that they need. They may be unable to get to the hospital, or the clinics are really just full of treating individuals with very severe COVID-19. And because of that, they either haven't been diagnosed quickly, so they've been able to spread it to others in their community, or they've really just got sicker and ended up being hospitalized. And so the numbers have increased since we've been in the COVID-19 pandemic. TB numbers have definitely increased, so it has an impact on it.
Okay, Dr. Joanne Turner, we'll have to leave it there. Thank you so much for joining us. That's Dr. Joanne Turner of Texas Biomed. Thank you.
Thank you. You're welcome.
We'll be right back.